Hey, Bill. Everybody.
All right, it is 4:04. We'll call the meeting to order. So first up, we last meeting we did not have a quorum, so we did not were unable to review the minutes. So if we could before we actually put it out to vote, I just wanted to go over a couple of things since not everyone was present. In the last meeting, which was July, we did not have a meeting in August. We did award the contract for construction to Morpal, and so they will be the general contractor. Okay. So the contract was awarded. PenFed has moved out of the building entirely. There's some rudimentary work that has to be completed, some painting that they agreed to do that has to be finished, but it is now open for us to begin construction. At this point, the contractors, subcontractors, architects are just doing some final preparations in order to start the actual physical work of construction, and we're expecting that to start within the next couple of weeks. In the last minutes, we had also talked about that Dr. Saxena from the city of Scranton would be joining us, and she has joined us. So we're happy to have her here. Great addition. She was taking the position that was originally held by Junie DeLizo, who went on to a similar job, although I think he was actually a director position in Maryland. And so we wish him well. And just looking at some of the other minutes, if there's anything else that any other selling points, nothing that we have to go over, I don't think. Anything else be included in existing in the agenda items. So with that discussion, if I could have a motion to approve the minutes as prepared.
I'll make a motion.
I'll take.
Wow.
First or second, whichever.
Okay. All right. So Dr. Sheth and Kelly will have seconded it. All right. So moving on. Now, this is some housekeeping we're doing regarding Dr. Corona and Dr. Cognetti. We did get approval through the commissioners to appoint both positions to the Board of Health, and they will be joining us at the next meeting, because we did not have a quorum the last time. I know this is somewhat backwards, but just to make everything clean, we are just going to I'm going to make a motion to accept Dr. Corona and Dr. Cognetti. We've had numerous conversations about this in the past, to the Board of Health. So if someone can make that motion.
So moved. Bob.
Okay, and Dr. Sheth second. All in favor, signify by saying aye.
Aye.
Aye. All opposed? All right, let's move on. Dr. Charles, if you want to talk about the flood response, the Department of Health and association with our EMA department, the county EMA department, have been extremely busy because of last week's flood. So if Dr. Charles, you give us an update.
Yeah, so with the flooding happening like a week ago, basically, we've been very busy. So our emergency preparedness manager, Katrina Bauer, she's the one working with EMA to make everything happen. So we had a meeting with all the municipalities, I think like on Monday after the flooding. So everybody was there and they were talking about what they can do and how FEMA can help not only individual business recover from that flooding. So what we do in the health department, we put out a survey, and all our health inspectors and health promotion people were going in the most affected area. Scranton, Clark Summit, I think they went up to Dalton doing those surveys. We had like more than 150 survey fill out. So people had to fill out their name, what was their damage, and what they expect from FEMA. So that was a very good response. And then we have like the mock event. I think Joanne sent you the flyers that's gonna happen tomorrow, Friday and Saturday, where people can come do the application. Food for the Poor will be there. There are about like 24 tables set up. Many organizations, the city, everybody will be there, and they can, not only have resources, but apply for FEMA. And well, we don't say that they're gonna have a lot of money, but at least they will have some help to recover from the flooding. So this is what we have been doing, working with EMA, and basically all the department people will be there helping with the application and talking to people, and try to help the community.
And just to add to that, Doctor, there's some of the other things that we've been doing. I know that they've been doing sending samples out of some of the water, looking for like E. coli infections, especially in wells that potentially were contaminated during the flood. And like Dr. Charles said, that our workers were going literally door to door, taking photos in some areas and then reporting back to see if there anything that was missed that had to be considered. So they were working. I know they don't get a lot of credit in our local newspaper, but there was the newspaper was informed of all those activities, and they choose to report what they're going to report.
And I also wanted to add that they got in contact with the West Nile virus coordinator for the county to make sure that that work also is done, because of all the water, the stagnant water and everything. So he has been really open and is on it, is working around the county, doing everything that they can, like, to avoid mosquito disease after that flooding and that stagnant water.
Right, and then we're just waiting on that'll be some time before we get the actual results. I'm sure they read in the paper about the second fatality. The first one was due to injuries. The second one was likely due to some type of to bacterial infection. Obviously, it was from a bacterial infection, but whether it was floodborne or hospital acquired or some other modality, we don't have 100% confirmation. Obviously, there is a thought that it was likely related to the flood, but we don't have confirmation, and so the cultures are being grown, and we will get that. And so that'll be an area. Obviously, that's why we sent out certain flyers about what to watch for and what to look for. In the event of floods, I think most people are looking at physical injury and drowning, but the other thing we'd like to get out to the public is the danger of disease, especially a flood of this magnitude that can seriously compromise the integrity of the sewage system. And so we'd like to get that out there as soon as possible.
And to follow up with that, we also set up a health department Facebook page. So every day or every 2 days, we try to post, some announcement, what people can do, especially after that flooding. So that page will be like interactive. If people have questions, we can answer them, and like communicate with the public more often.
So any questions before we move on to the next agenda item? Or comments? All right, we will keep you posted. If anything else arise from this, we'll keep the board apprised. We won't wait until the next board meeting to do that. So moving on, update on the clinic space in the lower level. We did speak or did that in the beginning when we were discussing the minutes from the previous meeting. The state said that they will come in and look at that space in the near future. So we're trying to arrange for them to look at the space that we're occupying. We've been having numerous discussions with the state regarding the space, the shared space with the right center, and ensuring that there is an actual separation of duties We believe it's a benefit to the community to have an FQHC LA present in the same building. And so we just have to prove to the state that there is separation, confidentiality, and I think we have a pretty solid plan in doing that. And so that's an ongoing discussion with the state. But plans are done, construction starting, so I think that's the most important thing. Any questions? So that leads us to the next piece. So because the construction obviously can't happen overnight, and we can't apply for a certification until we have clinic space, we were in the process of looking at a temporary clinic space for approximately 1 year. By doing that, it will free up Act 315 dollars and other funding from the state and federal government, various grants, etc. We have nothing coming into the county right now, and we're just going on our existing allocation. Obviously, that can't last forever. And so we would like to apply and get certification as soon as possible. Once we find the temporary clinic space, we have to do a couple more hires, but almost everyone's been hired at this point. And then we're ready to apply to the state. All the regulations have been passed through a commissioners meeting. Everything else has been done. So we are looking at an existing space that we're just waiting to get an estimate on the lease, and that's supposed to be coming forthwith. And when that happens, obviously we would have to put that on the commissioner's agenda and move that forward. We do have a couple backup ideas as well, but the primary, what we actually need to do is get that space. Once that's done, we'll set up the clinics there, put our hours in, etc. Get everything populated, all the equipment ordered that we need, and then we apply. Because as I've said numerous times during our meetings, that the state will not give us anything until everything is 100% completed. That means physical plant, hiring, policies, procedures, everything. So this is the biggest piece that's missing right now, is the physical plant. And once that's done, then that opens up the possibility of getting the revenue stream going for the county, so we could sustain this very important initiative. So any questions on this? All right. So when this is just an open discussion, are there any comments, observations, questions? I mean, this is a different format than before, slightly different than the Teams meeting. This will be on ECTV, and so will be recorded. If there is we're hoping that we didn't have any technical glitches. It seemed to work out pretty well, and it looks like we'll be doing this going forward. So any discussions, questions about anything that we covered, or anything that you may be interested in discussing?
I don't have anything at the moment.
Okay.
would
I
add-
think we're at this point right
present-
now where we're so close to getting the certification as far as applying for this. Once that happens, then the board about, as I said before, it seems that we're in this kind of holding pattern and just giving updates. Decisions obviously will be made and such once we're certification, such as getting certain types of data, where to collect the data, what kind of allocation of resources, things of that nature. Those are the things that right now we really can't make a lot of the decisions because the state is making them. So even with the testing, for instance, the testing in the flood, if we receive information and we send the samples out, it's ultimately the state that's going to make that decision on what to do, and any kind of response, any kind of emergency response that would be required from the health perspective. Obviously, our EMA would take care of any of the physical pieces like construction and property damage and access to, roads, things like that. But as far as public health, we can make recommendations, but until we get the certification, we don't have the power to actually do or make the recommendations or findings.
So Bill, once the certification is approved, is it a light switch that goes off that the state then takes a different role? And what do we know about the nature of that role
Sure.
in terms of the monitoring of the work?
So it almost is like a light switch in theory. So we'll give you the theory part and then the practical. Theory is that once we receive the certification, within 30 days, we make a notification to everyone that we are open for business. We are taking over most of what the state does. And when I say the state, it's the Department of Health functions, some of the Department of Agriculture functions, and part of the environmental, the DEP functions. And so we would be responsible. The state then would no longer be involved in those to an extent. Now they are still going to be involved, but we'll do all the retail food. We'll do anything that requires like a health emergency. If there's a disease outbreak in, say, a school, normally it would be the State Department of Health would either do the quarantine or whatever they would have additional testing, whatever plan would be in place to come. We would actually be making that decision at the county level. We would just have to report it to the state. So in theory, it is a light switch.
So such decisions are they made by the board or are they made by you and Dr. Charles? Or how does
So
that?
it's a combination. The board has the authority. If we, for instance, say that there is a need for some kind of public health intervention, using COVID would be a perfect example. Masking mandates, whatever the case is, as a board, we would then promulgate what our response is. Ultimately, the commissioners have to approve that, but it would be our role. Our legal role is to recommend that to the commissioners, and then within a certain time period, if it's either not acted upon, then it becomes then a regulation. Or the commissioners could choose to not vote or vote it down, but ultimately it will start with the board as far as certain regulations. So we would be making those decisions at a board level. So in the terms of a crisis, there may be times where we'd have to have an emergency board meeting, like a disease outbreak, to formulate a response.
Thanks.
So that's the light switch piece. The reality of what we've learned from Delaware is it's not so much a light switch as a dimmer going on. So that they were, although they received their certification, there were certain things that they weren't able to do. They still had to use some equipment and some personnel from the state. So they had kind of a hybrid going on for quite some time. Dr. Charles, I'm not sure if there's, as of June, they were still using the state for some things, and they were certified in April of 2022.
2022, yes. And this is why the state has been so hard on us, because they don't want to do that with us. They want once we certify that we are ready to go. They don't want to be doing the work anymore once we certified. So this is why there has been a lot of pushback from them to us because of Delaware, actually.
Right, and because Delaware is the first county in roughly 30 years to have a local Department of Health, and we will be the second. The lessons learned, that's why they've asked for us to have numerous redundancies in our staffing. Sometimes a bit much, but they've asked for a lot more, I think, than they initially asked of Delaware because of lessons learned. But I think we do have a solid plan, and to be in fairness to Delaware, we've learned from them as well. So we've had numerous conversations with Delaware, kind of said, so what not to do, and so, well, don't do this and do this, and so we've also learned from Delaware as well. And they've been extremely helpful. When we did a site visit in June, very helpful. We toured their facilities, asked the questions of all of their departments that are analogous to our departments. But ultimately, because there wasn't a lot of guidance out there other than the statute, right? So in most government agencies, you have your statutes, and then you have the department that'll promulgate regulations based on those statutes. With the Department of Health, they just had the statute. So the answer was always, if you had a question, well, look at the statute. Well, anyone that's looked at statutes knows that it's not prescriptive usually. It just gives you a basic template of what to do. It doesn't give you the how to. And so that's kind of where Delaware fell into that. And so the state has been making things and promulgating rules and around the development of departments of health going forward. Unfortunately, they didn't really exist until Delaware and us, so it's still in a learning process. And that's why I use the dimmer switch analogy, because although we've planned everything based on our population and what we think is correct, once it goes live, those things may change. We may be coming back to the board and asking for some structural things that need to be changed. But until we go live, we really aren't going to know. We've taken our best hypothesis based on the needs of the community and what that staffing looks like. But until the boots hit the ground, we're really not going to, we won't know. And the reason that we won't know is like currently the Department of Health, and no disrespect to the State Department of Health, but they're not as accessible as we're going to be, right? They're in a state office building. Most people don't know it exists. If you ask anyone on the street, they don't know where the Department of Health is, where the clinic is. We're a big, bright building that we want people to come and get treated. We want people here. So we are going to be promoting that. The volume may be much more than the state is getting currently, or it may be the same. We won't know until we open the doors. Our theory is that we'll see more, but we don't know. Any other questions or discussion?
I just had a question about the school health program under Department of Health. Is that a facet that we are taking on, or will that remain at the state level?
That I believe that we, if I remember correctly, and Dr. Charles, please, that we will be the point of contact for the school health program.
Yeah,
Now,
we will have like a nurse that will be like the school health liaison. And we also will be inspection at the school level. That will be our role once we're certified.
Okay.
and that's something we would really like to foster is having a very robust relationship with the schools around public health and education. And we saw, especially around the pandemic, how education is so important. Dispelling rumors, dispelling and just basic critical thinking and scientific method. And that's those are the kind of things that we would love to partner with our schools regarding public health.
I did just want to let you know, we do have all the local superintendents that come here on a bi-monthly basis. Obviously, they are across Lackawanna, Susquehanna, and Wayne counties. But if there were an interest in finding a time when all of those superintendents might be together from Lackawanna County, I can certainly share that information, and we may be able to have a breakout from there, just for information sharing at that level.
That would be great. Because like I said, we'd like to have a robust relationship. We found that through communication, even with in the child welfare part of human health and human services, that was critical. Unfortunately, because of staffing there, we had to pull that back, but that's on our list to restore it as soon as possible, because reaching out to in the schools is probably the most effective way that we can change behaviors, honestly. So, and that's something that we'd love to partner with. Anything else before we move on or break? All right, if there is nothing else, do we have a motion to adjourn?
Motion.
I have a second.
Second.
All right. Thank you. Thank you, everyone, and I will see you next month. Or
Thank
sometime,
you.
some of you I'll see before then. All right.
Yep.
Have a good day.
Take care.
Thank you. Bye-bye. Have a good night.
Bye.